Let's see about the normal Peurperium. So in this video, we'll cover about the following topics: the definition of Peurperium, the changes seen in uterus, changes in cervix, vagina and external genitalia during the Peurperium, systemic changes, and some points about lactation, care of mother during Peurperium, postnatal care, resumption of menstruation and ovulation. These will be the topics covered under the normal Peurperium. Firstly, what is the definition of Peurperium? Peurperium is the period which starts after the third stage of labor, that is after the delivery of the placenta, and lasts till the genital organs have assumed their normal condition. So this takes about 6 weeks. So the normal puerperial period is 6 weeks post delivery. Six weeks is the normal puerperium. So the next is changes seen in the uterus during the puerperium. Uterine size. There is decrease in uterine size after the third stage of labor. So immediately after delivery, the uterus becomes hard and decreases in size, and the fundus comes and lies just below the umbilicus . This is the first change, and then during the puerperium it gradually decreases in size further, and then it enters the pelvis again by about 10th or 12th day. It becomes a pelvic organ. This process is called as involution. So uterine involution is one of the change seen during the puerperium. And this rate of involution varies from person to person, but there is progressive involution seen, and the size of the individual muscle fibers also decrease. So the individual muscle fibers also decrease in size. And then the weight of the uterus also decreases as the size decreases. The immediate postpartum uterus weighs about 1 kg, and by 4 to 6 weeks after delivery it becomes almost around 100 grams, about the weight of pre-pregnant uterus. This is about the involution. So one abnormality in this leads to subinvolution of the uterus. This is said to occur when there is an arrest or delay of involution of the uterus. So what are the features which tells that there is subinvolution? There is delay in decrease in uterine size, and there is prolonged lochial discharge. We will see what is lochial discharge a little later. And then when there is hemorrhage, these are the factors which tell that there is subinvolution of the uterus. And the causes for subinvolution include, there could be any retained placental products, or any pelvic infection, so the next will be the uterine vessel changes. The vessel changes, as the uterine vessels are hypertrophied during pregnancy. The hypertrophied vessels get obliterated by thrombosis. This obliteration occurs by hyaline change in larger vessels, and in place of these large vessels, new smaller vessels develop. This is uterine vessel change. Next will be about lochia, which is nothing but a discharge from the uterus. So there is a discharge from the uterus during a normal Peurperium period. This is called as lochia. Let's see the reason for the lochia. So immediately after delivery, the endometrium of the uterus is thick and rough, especially over the placental site. So the degenerating decidua along with the blood clots and the bits of fetal membranes, if any, all these undergo degeneration and they are released out in the lochial discharge. So all these are the components of the lochial discharge. After these are shed, there is regeneration of the endometrium. And the regeneration begins in the first week after labor, and it completes in about a month. Except over the placental site, which gets delayed. So now let's see something about the lochia, that is the discharge from the uterus. The lochia is usually red for the first 3 days because of the increased blood. This is called as lochia rubra, because rubra stands for red. Then subsequently it turns pink in color for 3 to 10 days. This is called as lochia serosa. Then after the 10th day it becomes pale due to the presence of leukocytes and this is called as lochia alba. This is seen from 10th to 12th day. So this is about lochia. Normally a healthy lochia has a sweetish odor. It is not foul smelling. So if it is foul smelling, then it means that there will be any infection. And also the healthy lochia has a property of staining the diaper in the center, that is the center appears darker and the periphery is pale. Whereas in case of infection it is the other way around. The periphery stains dark and the center is pale because of the degeneration of the red blood cells due to infection. This is the changes seen in the uterus during the puerperium. Next is the changes seen in the cervix, vagina and the external genitalia. First, the cervix. So as the cervical canal is dilated during the labor, the canal gradually becomes smaller during the puerperium. The external os of the cervix is always patulous in a multipara. It never closes after delivery, whereas it is closed in nullipara. So the external os after delivery doesn't assume its pre-gravid appearance. It remains somewhat wider and there will be bilateral depressions at the sites of laceration. And the changes seen in the vagina include the vaginal outlet is relaxed and there could be laceration seen because of the process of labor. Then the hymen disappears completely and it is replaced by a number of small tags of tissue which then cicatrize. These are called as carunculae myrtiformis. Which is a sign of parity. Carunculae myrtiformis. Next, the changes seen in the perineum. The perineum also is relaxed and the pelvic floor is also stretched. In labor, so there is gradual regaining of the tone. But there will be gapping of the vulva. Usually remains. So these are all the changes seen in the cervix, vagina and the perineum. We'll see the other changes in our subsequent videos. Thank you.